Medical Terminology, Lesson 1. Basic word structure. Medical terms can be divided into 2 to 4 parts. Even if a word is unfamiliar to you, you can figure out the meaning by knowing what each part means. Important elements of medical terms. Root, foundation of the term. Suffix, word ending. Prefix, word beginning. Combining vowel. Vowel, usually O, that links the root to the suffix or the root to another root. How to read medical terms. You should read medical terms starting from the suffix and returning to the beginning of the word. Epigastric, epi, prefix meaning above. Gastra, root meaning stomach. Ic, suffix meaning pertaining to. Epigastric, pertaining to above the stomach. And if you see, you start with the suffix and you go to the beginning. So, pertaining to above stomach. Rules for combining vowels. Drop the combining vowel before a suffix that begins with a vowel. Root, gastro, suffix, itis. Correct is gastritis. Incorrect is to have the O in the root. Keep the combining vowel between 2 roots even if the second root begins with a vowel. Root, gastro. Root number 2 is entero. Suffix, logi. Or logi, I don't know how you would exactly pronounce the correct. Gastroenterology. And notice that they keep the combining vowel in these cases. Incorrect would be to remove the O in gastro. So the difference between that is that of combining vowel before a suffix that begins with a vowel, you drop the combining vowel. But if it's before another root, then you keep it. Combining forms. A combining form is the combination of a root with a combining vowel. For example, arthro. Arthra is the root and the O is the combining vowel. O is the most frequently used combining vowel. Combining forms. Adeno means gland. Arthro means joint. Bio means life. Carcino means cancerous or cancer. Cardio means heart. Cephalo means head. Cerebro means cerebrum. Schizo, I don't always know how you pronounce them as, combining forms. It means to cut. Crino means to secrete, to form, or to give off. Cysto means urinary bladder, sac containing fluid, or cyst. Cyto means cell. More combining forms. Dermo and dermato both mean skin. Electro means electricity. Encephalo, not to be confused with cephalo, which means head. Encephalo means brain. Entero means intestines. It usually refers to the small intestines. Erythro, red, means red. Gastro means stomach. Glyco means sugar. Noso means knowledge. Gyneco means woman or female. Hemato means blood. Hemo also means blood. Hepato means liver. Iatro means treatment or physician. Leuko means white. Logo means study, or logo, I don't know. Nephro means kidney. Neuro means nerve. Onco means tumor. I always have that problem with that. Ophthalmo, I think. That one's always been hard for me. Osteo, bone. Patho, disease. Pedo, child. Psycho, mind. Radio, x-rays. Reno, kidney. This also, remember, there's two forms actually for kidney. There's nephro and then there's reno. Which one is used? One I think is Greek and the other was Latin. They use them for two different ways, so it's not actually as confusing as you would think. They'll get into that more later. Rhino means nose. Sarco means flesh. Secto means to cut, just like schizo or sizo or whatever. Thrombo means clot or clotting, and uro means urinary tract or urine. Quiz time. The answers to the questions will follow each slide. In the combining word above, endocrinology, label the A, combining vowel, B, prefix, C, suffix, D, root, E, combining form. Combining vowels. Combine the roots with the suffixes correctly. So with each one, how would you combine the root arthro with the suffix itis? And that's how we're doing. Number 3 is a lot more complicated because we're going to have two roots with a suffix. What vowel is frequently used as a combining vowel? Terminology. Write the combining form that goes with the definition. Write the combining form that goes with the definition, doing the same thing. Notice that some of these have two terms that will go with them. Define the following combining forms. Remember, you can always pause the video. I'm going to have to make the little spaces shorter because I'm starting to run out of juice here, folks. And that's the end of the quiz. Quiz time. Answers will follow the slide. Match the suffix with the correct meaning. And remember, guys, you can always stop the video if you need more time. Match the suffix with the correct meaning. Match the suffix with the correct meaning. Label whether something is a prefix or suffix, and then define its meaning. Pair the correct prefix with its definition. Define the prefixes. And notice that some of these have two definitions. Write the word that goes to the definition. Define the words. Write the correct word for the definition. Oops, excuse me, folks. Denise. Medical terminology, lesson 3. Electrocardiogram. The suffix gram means record. Record of the electricity of the heart. Electroencephalogram. Record of the electricity of the brain. Endocrine gland. A ductless gland, a gland that secretes within. Endocrinologist, a specialist of the endocrine system. Endocrinology, the process of studying secreting within, or the process of studying the endocrine system. Endoscope, instrument to visually examine within. Endoscopy, process of visually examining within. Enteritis, inflammation of the intestines. Enteropathy, disease condition of the intestines. Epidermis, above the skin, outermost layer of skin. Epigastric, pertaining to above the stomach. Erythrocyte, red cell. Excision, process of cutting out. Exocrine glands, a gland that secretes outward, a gland on the surface of an organ that excretes through a canal or duct. Gastrectomy, removal of the stomach. Gastric, pertaining to the stomach. Gastroenterology, process of studying the stomach and intestines. Gastronomy, incision of the stomach. Gynecologist, specialist in female study, a specialist that deals with the care and diseases of the female reproductive system. Gynecology, process of studying females, a branch of medicine that deals with the care and diseases of the female reproductive system. Hematology, process of studying blood. Hematoma, blood tumor. Hemoglobin, blood protein. Hepatitis, inflammation of the liver. Hepatoma, liver tumor. Hyperglycemia, excessive blood sugar. Hyperthyroidism, above normal thyroid condition. Hypodermic, pertaining to under the skin. Quiz time. The answers will follow each slide. Use the word parts on the left to form the words to the definitions on the right. And there's a bonus question here that we didn't go over in this lesson, but was in a prior lesson. Answers. Number 1 was electrocardiogram. Number 2 was endocrinology. Number 3 was gynecology. Number 4 was dermatology. Number 5, electroencephalogram. Number 6, gastroenterology. Number 7, hematology. Questions. Number 1. The suffix "gram" means blank. Number 2, little Johnny tells you that his father is a doctor that looks at vaginas all day. You assume that Johnny's father is what type of doctor? Number 3, what is a ductless gland called? Number 4, what is a gland called that is found on the surface of an organ and excretes through ducts? Number 5, what is a blood tumor called? Number 6, where would a hepatoma be found? Number 7 is a bonus question. As I said, that means we didn't go over it in this lesson, but it was in a prior lesson. A decision or conclusion reached after a medical examination is called a blank. Answers. Number 1, record. Number 2, gynecologist. Number 3, endocrine gland. Number 4, exocrine gland. Number 5, hematoma. Number 6, liver. Number 7, diagnosis. Write the word for the definition given. Number 1, a specialist of the endocrine system. Number 2, disease condition of the intestines. Number 3, pertaining to above the stomach. Number 4, red cell. Number 5, blood protein. Number 6, excessive blood sugar. Number 7, above normal thyroid condition. Number 8, pertaining to below the skin. Number 9, above the skin. Number 10, process of cutting out. Number 11, pertaining to the stomach. Number 12, instrument to visually examine within. Number 13, process of visually examining within. Answers. Number 1 is endocrinologist. Number 2 is enteropathy. Number 3 is epigastric. Number 4 is erythrocyte. Number 5 is hemoglobin. Number 6 is hyperglycemia. Number 7 is hyperthyroidism. Number 8 is hypodermic. Number 9 is epidermis. Number 10 is excision. Number 11 is gastric. Number 12 is endoscope. Number 13 is endoscopy. Similar but different. Number 1, Sally has inflammation of the intestines. She suffers from enteritis or hepatitis. Choose which one. Number 2, Jack is going for a procedure where they are removing his stomach. He is having a gastrotomy or a gastrectomy. Number 3, John suffers from inflammation of the liver. He has enteritis or hepatitis. Number 4, the doctor is making an incision into the stomach. She is performing a gastrotomy or gastrectomy. Answers. Number 1 was enteritis. Number 2 was gastrectomy. Number 3 was hepatitis. Number 4 was gastrotomy. Finis. Medical terminology, lesson 4. Hypogastric, pertaining to below the stomach. Hypoglycemia, deficient blood sugar condition. Iatrogenic, produced by physician or treatment, usually refers to adverse reactions due to treatment or physician interference, or physician intervention, rather. Incision, process of cutting into. Leukemia, white blood condition, a condition of an increased number of abnormal, immature white blood cells. Leukocyte, white cell. Leukocytosis, abnormal white cell condition. Usually refers to the increase of normal white blood cells when the body is fighting an infection. Nephrectomy, removal of the kidney. Nephritis, inflammation of the kidney. Nephrology, the process of studying the kidneys. Nephrosis, abnormal condition of the kidneys. Neural, pertaining to the nerves. Neuralgia, nerve pain. Neurologic, pertaining to the study of nerves. Neurology, process of studying the nerves. Oncologist, specialist in the study of tumors. Oncology, process of studying tumors. Ophthalmologist, specialist in the study of the eye. Ophthalmoscope, instrument to visually examine the eye. Osteitis, bone inflammation. Osteoarthritis, bone and joint inflammation. Osteotomy, incision of the bone. Pathogenic, produced by disease. Pathologist, specialist in the study of diseases. Pathology, process of studying diseases. Pediatric, pertaining to the treatment of children. Pericardium, tissue surrounding the heart. Prognosis, condition of knowing before. A doctor's opinion about how a person is going to recover from an illness or injury. Prostate gland, an organ found in men and male animals that produces the liquid in which sperm is carried. Psychiatrist, specialist in the treatment of the mind. Quiz time. I'll be including some words that weren't in this lesson that were in prior lessons, mainly to compare them to other words that are very similar. The answers will follow each slide. Match the words at the left to the questions on the right. Number 1. Andrea had an adverse reaction to the medication the doctor prescribed for her. She had an blank response. Number 2. The microorganisms were responsible for the illness. They are blank. Number 3. Dr. Sloth is a physician that treats children. She is a blank doctor. Number 4. The artery is found in the region below the stomach. It is a blank artery. Number 5. Brian has a condition that affects the nervous system. The problem is blank. Answers. Number 1. Iatrogenic. Or iatrogenic, rather. Number 2. Pathogenic. Number 3. Pediatric. Number 4, hypogastric. Number 5, neurologic. Match the answers at the left to the questions on the right. Number 1, the doctor is making an incision into the bone to correct a deformity. He is performing in blank. Number 2, an abnormal condition of white blood cells is known as blank. Number 3, nerve pain is known as blank. Number 4, a condition of low blood sugar is known as blank. Number 5, Angela is having a kidney removed. She is having a blank. Answers. Number 1, osteotomy. Number 2, leukemia. Number 3, neuralgia. Number 4, hypoglycemia. Number 5, nephrectomy. Match the answers at the left to the questions on the right. Number 1, Alicia has an abnormal increase in white blood cells because she has the flu. This is an example of blank. Inflammation of the bone is known as blank. Number 3, Dr. Matthews' opinion that Mr. Alcrow will get better is bleak. The blank is bad. Number 4, after many tests, Dr. Matthews' blank was that Mr. Alcrow was suffering from liver failure. Number 5, an increase in immature abnormal white blood cells is called Number 6, an abnormal condition of the kidneys is known as blank. Number 7, inflammation of the kidney is known as blank. Number 8, Mr. Sellers suffers from inflammation of the bones and joints. This is known as blank. Answers. Number 1 is leukocytosis. Number 2 is osteitis. Number 3 is prognosis. Number 4 is diagnosis. Number 5 is leukemia. Number 6 is nephrosis. Number 7 is nephritis. Number 8 is osteoarthritis. What type of logy is it? Number 1, a medical specialty concerned with the kidneys and especially with their structure, functions, or disease. Number 2, a branch of medicine concerned especially with the structure, functions, and diseases of the nervous system. Number 3, this branch of medicine deals with the study of tumors. Number 4, the study of the essential nature of diseases and especially the structural and functional changes they produced by them. Answers. Number 1 was nephrology. Number 2 was neurology. Number 3 was oncology. Number 4 was pathology. What type of specialist am I? Number 1, I specialize in the study of tumors. What am I? Number 2, I treat diseases of the eye. What am I? Number 3, I examine bodies to determine cause of death. What am I? This is a trick question. This type of doctor can interpret the changes caused by disease in bodily tissues and fluids. Number 4, I treat mental, emotional, and behavioral disorders. What am I? Answers. Number 1, an oncologist. Number 2, ophthalmologist. Number 3, pathologist. Number 4, psychiatrist. Finis. Medical terminology, lesson 5. Sound the same but different spelling and meaning. Ileum, third part of the small intestine. Ileum, part of the hip bone. The small intestine ileum, notice, is spelled I-L-E-U-M. The ileum that's part of the hip bone is spelled I-L-I-U-M. Urethra. Tube leading from the urinary bladder to the outside of the body. Ureter. A tube that leads from the kidney and inserts into the urinary bladder. There are 2 ureters, one for each kidney. When skin goes bad. Excuse me, folks. Okay. Epithelial cells cover the outside body. They also line organs, cavities, and tubes within the body. A carcinoma is a cancerous tumor that grows from epithelial cells. A basal cell carcinoma is the most common form of skin cancer that usually occurs on sun-damaged skin. Biopsy. Living tissue is removed from the body and viewed under a microscope. Cephalic presentation. A head-first position for the delivery of an infant. A big name for strokes. CVA stands for cerebrovascular accident, more commonly known as a stroke. A stroke occurs when blood vessels are damaged in the cerebrum and blood is prevented from reaching functional areas of the brain. Brain cells are damaged because they are deprived of oxygen and nutrients. This is why people suffer from physical and mental disabilities after a stroke. Cerebrum, the largest part of the brain. Combining form, vasculo. Vasculo means blood vessel. Comparison. Endocrine glands secrete hormones directly into the bloodstream. Exocrine glands release secretions like saliva, sweat, and tears through ducts to the outside of the body. Medical abbreviations. EKG, commonly used, or ECG makes more sense as an abbreviation since cardio begins with a C and not a K. Both mean electrocardiogram. Another abbreviation, EEG, is the abbreviation for electroencephalogram. Hemoglobin and erythrocytes. Erythrocytes are red blood cells. They are responsible for carrying oxygen in the blood. Hemoglobin is the part of the red blood cells that contains iron, carries oxygen through the body, and gives blood its red color. Thrombocytes, more commonly called platelets. These cells are responsible for clotting the blood when there is an injury. This prevents a person from bleeding to death. Quiz time. The answers will follow the questions slide. Does this have the ileum or ileum? Ilium, I-L-I-U-M, is part of the hip bone. Questions. Number 1. The third part of the small intestine is called blank. Number 2. A tube leading from the urinary bladder to the outside of the body is called the blank. Number 3. The ureter is a tube that leads from the blank to the urinary bladder. Number 4. How many ureters does a person have? Number 5. Blank cells that cover the outside of the body and line organs, cavities, and tubes within the body. Number 6. A cancerous tumor that grows from number 5. Answers. Number 1 is ileum. Number 2 is urethra. Number 3 is kidney. Number 4 is tube. Number 5, epithelial. Number 6, carcinoma. Questions. Number 1. The picture at the right shows the most common form of skin cancer that usually occurs from sun-damaged skin. It is called a blank, blank, blank. Number 2. Living tissue is removed from the body and viewed under a microscope. Number 3. Blank, blank, the head first position for the delivery of an infant. Answers. Number 1 is basal cell carcinoma. Number 2 is biopsy. Number 3 is cephalic presentation. Questions. Number 1. What is the common abbreviation for a stroke? What do the abbreviations stand for? Number 2, why do people suffer mental and physical disabilities after a stroke? Number 3, the largest part of the brain is called the blank. Number 4, what does the combining form vasculo mean? Number 5, blank glands secrete hormones directly into the bloodstream. Number 6, blank glands release secretions into ducts and lead to the outside of the body. Answers. Number 1, CVA, cerebrovascular accident. Number 2, blood vessels are damaged in the cerebrum and blood is prevented from reaching functional areas of the brain. Brain cells are damaged because they are deprived of oxygen and nutrients. Number 3, cerebrum. Number 4, blood vessel. Number 5, endocrine. Number 6, exocrine. Which word does not belong to the system they are listed under? Under endocrine, we have pineal gland, ovaries, sweat, pituitary gland, and pancreas. Which word doesn't fit in the endocrine system? Under exocrine, we have tears, saliva, mammary glands, and testes. Which word does not fit? The answers are in red. Sweat does not belong in the endocrine system. That's an exocrine. That belongs in the exocrine. And testes are in the endocrine system, not the exocrine. Questions. Number 1, the abbreviation for electrocardiogram is A, EKG, B, ECG, C, EEG, D, A and B. And when I mean A and B, by the way, I mean these two, not the A and B is the abbreviation. Number 2, the abbreviation for electroencephalogram is A, EKG, B, ECG, C, EEG, D, A, and B. Answers. Number 1 was D. Number 2 was C. Questions. Number 1. In this group, one of them, erythrocytes, leukocytes, thrombocytes are responsible for carrying oxygen in the blood. Number 2, blank is the part of number 1 that contains iron, carries oxygen through the blood, and gives blood its red color. Number 3, blank are cells that are responsible for clotting the blood when there is an injury so the person doesn't bleed to death. Number 4, what is number 3 commonly called? Answers. Number 1 was erythrocytes. Number 2 is hemoglobin. Number 3 is thrombocytes, but if you wrote platelets, that was right too. And number 4 is platelets. Finis. Quiz time. The answers will follow the slide. Questions. Excuse me, folks. Okay. Number 1, what comes first, a diagnosis or a prognosis? Number 2, a mass that forms when blood escapes from blood vessels and collects as a clot in a cavity, organ, or under the skin is called in blank. Number 3, when blood collects above the brain's outermost covering, usually due to external trauma, a person has a blank hematoma. Answers. Number 1 is diagnosis. Number 2 is hematoma. Number 3 is epidural hematoma. Match the term to the definitions at the right. The terms are type 1 diabetes, type 2 diabetes, insulin, pancreas, glucose, hyperglycemia. And, let me see. Okay. Number 1. Released by the pancreas to escort sugar from bloodstream to a cell. Number 2, another name for sugar. Number 3, type of diabetes where a person has ineffective insulin. Number 4, a condition where a person, because they lack insulin or have ineffective insulin to escort sugar into a cell, causes the glucose to build up in the bloodstream. Number 5, type of diabetes where a person lacks insulin. Number 6, an endocrine gland near the stomach that is responsible for releasing insulin. Answers.
1, 2, 3, 9, 2, 3, 4, 1.
Answers. Number 1 is insulin. Number 2 is glucose. Number 3 is type 2 diabetes. Number 4 is hyperglycemia. Number 5 is type 1 diabetes. Number 6 is pancreas. Questions. Number 1, orthopedists, A, used to be doctors that straightened children's bones and corrected deformities. B, specialize in disorders of bones. C, specialize in disorders of muscles. D, all of the above. E, A, and B. Number 2, what does the combining form ortho mean? Number 3, blank and blank are two combining forms that both mean kidney. Number 4, blank is a Latin term that is used to describe the kidney. Number 5, blank is a Greek term used to describe abnormal conditions of the kidney and the operative procedures associated with it. Answers. Number 1 is D. Number 2 is straight. Number 3 is reno and nephro. Number 4 is reno. Number 5 is nephro. Questions. Number 1. A blank is a tumor that grows from cells of connected tissues like muscle, bone, and fat. Number 2, a blood clot that forms is called a blank. Number 3, a condition of clot formation is called blank. Number 4, malignant tumor of the liver that develops from epithelios is called a blank. Number 5, and blank is a physician who specializes in diagnosing and treating, surgically and medically, disorders of the eye. Answers. Number 1 is sarcoma. Number 2 is thrombus. Number 3 is thrombosis. Number 4 is epitoma. Number 5 is ophthalmologist. Questions. Number 1. In blank, examines eyes and prescribes corrective lenses and treats eye diseases. Number 2. In blank, grinds lenses and fits glasses. Number 3. What does the combining form metro mean? Number 4. What is the picture below of? Number 1, optometrist. Number 2, optician. Number 3, to measure. Number 4, hematoma. Label what the pictures are of. Answers. Pancreas and an epidural hematoma. Questions. What is the picture to the right of? A. Carcinoma. B. Sarcoma. C. Hematoma. D. Epitoma. B. Finished. Medical terminology, Lesson 7. Definition. Anemia is a condition of decreased number of erythrocytes or abnormal hemoglobin within the red blood cells. Singular and plural. Notice the spelling difference between these two words in the singular and plural. There is also a pronunciation difference. In the singular, notice that they end in is, and they are pronounced diagnosis and prognosis. In the plural, the is at the end is changed to es, and they're pronounced diagnoses and prognoses. Epidermis, outermost layer of skin. Dermis, middle layer of skin. How to use the prefix hypo. When hypo is used with a part of the body, it means below. For example, hypogastric means pertaining to below the stomach. Hypo can also mean deficient, under, less, or less than normal. Hypoglycemia means deficient blood sugar condition. Pericardium, a membrane that surrounds the heart. The thyroid gland. The thyroid is an endocrine gland located in the neck. It secretes a hormone called thyroxine, also known as T4. Thyroxine causes the cells to burn fuel and release energy. However, if too much thyroxine is secreted, it can cause hyperthyroidism. Nephrologist and Urologist. A nephrologist diagnoses and treats kidney diseases. He does not operate on the urinary tract, but treats kidney disease with medication. A urologist operates on the organs of the urinary tract and treats the male reproductive system. Tachycardia, increased heart rate. Exophthalmos, bulging eyeballs, a symptom of hyperthyroidism. Quiz time. The answers will follow the question slide. Number 1. Blank is a condition that results from either a decreased amount of erythrocytes or abnormal hemoglobin within the red blood cells. Number 2. Write the plural of diagnosis. Number 3. Write the singular of prognoses. Number 4. The outermost layer of skin is called the blank. Number 5. The middle layer of skin is called the blank. Number 6. True or false? When the prefix hypo is used with a part of the body, it always means deficient. Number 7. A membrane that surrounds the heart is called the blank. Number 8. The blank is an endocrine gland located in the neck. Answers. Number 1 is anemia. Number 2 is diagnosis. Number 3 is prognosis. Number 4 is epidermis. Number 5 is dermis. Number 6 is false. Number 7 is pericardium. Number 8 is thyroid. Questions. Number 1. Blank is a hormone released by the thyroid that causes cells to burn fuel and release energy. Number 2, an abbreviation for number 1 is blank. Number 3, if too much of number 1 is secreted, what condition does it result in? Number 4, a blank diagnoses and treats kidney disease with medication. Number 5, a blank operates on the organs of the urinary tract and treats the male reproductive system. Number 6, blank means increased heart rate. Number 7, blank means bulging eyeballs. Number 8. What condition has number 7 as a symptom? Answers. Number 1 is thyroxine. Number 2 is T4. Number 3 is hyperthyroidism. Number 4 is nephrologist. Number 5 is urologist. Number 6 is tachycardia. Number 7 is exophthalmos. Number 8 is hyperthyroidism. The end. Medical terminology, Lesson 8. The basic unit of all living things. The cell is the basic unit of all living things. They are found in both plants and animals. All tissues and organs in the human body are composed of cells. All cells are composed of a jelly-like substance that is made up of water, protein, sugar, acids, fats, and several minerals. Parts of a cell. The cell membrane surrounds the cell and protects it. It controls what comes into and what goes out of a cell. The nucleus is the brains of the cell, the control center. It oversees cell division. It defines the structure and function of cells. Rod-shaped chromosomes are found inside the nucleus. All cells in the human body contain 23 pairs of chromosomes. Chromosomes contain several thousand genes that are arranged in an orderly sequence. Each gene contains deoxyribonucleic acid, or DNA for short, which regulates the activities of a cell according to the arrangement of genes. Some of the activities it directs when it passes out of the nucleus to the rest of the cell is cell division and protein synthesis. Exceptions. Spermatozoan, sperm for short, and eggs, unlike other human body cells, contain 23 unpaired chromosomes. Other cells contain 23 pairs. When a sperm and egg unite and form an embryo, then there are 23 pairs of chromosomes, or 46 individual chromosomes. Karyotypes. A karyotype is a photograph of a person's chromosomes. They are arranged by size, shape, and number. Obstetricians often recommend an amniocentesis for pregnant women for a karyotype to see if the chromosomes are normal. The chromosomes are treated with chemicals so that the bands of light and dark areas can be seen. This is a karyotype of a normal male. The 23rd pair shows the gender as XY. If the person had been female, it would show XX. Abnormal chromosomes. An amniocentesis is a procedure where the sac around the fetus is punctured so that fluid and cells can be removed. One example of a chromosomal abnormalities babies can be born with is Down syndrome. A child with Down syndrome has an extra of chromosome 21, resulting in 47 chromosomes rather than the normal 46. For this reason, Down syndrome is also called trisomy 21 syndrome. Down syndrome. Down syndrome occurs in 1 in every 750 live births. However, the older a woman is when she has a baby, the more risks there are for chromosomal abnormality occurring. Some physical features of Down syndrome are a somewhat flat, small nose and upward slanted eyes. Children with Down syndrome also suffer from mental and heart defects. Cell structure. The cytoplasm is everything that is outside the nucleus but within the cell membrane. It does the work of the cell. If it is a muscle cell, it is responsible for contracting. If it is a nerve cell, it transmits impulses. It contains specialized parts that supply the chemical needs of cell. The word cytoplasm is made up by the combining form cyto, which means cell, and the prefix plasm, which means formation. Quiz time. The answers will follow the question slide. Match the term to the definition. The terms are cell, cell membrane, nucleus, chromosomes, genes, deoxyribonucleic acid, spermatozoan. Definitions. Number 1. Each cell contains 23 rod-shaped blank that are found inside the nucleus. Number 2. Basic unit of all living things. Number 3. The fancy name for sperm. Number 4. The brains of the cell, which handles everything from cell division to determining the structure and function of a cell. Number 5, surrounding the cell and protects it, determines what goes in and what comes out. Number 6, chromosomes contain several thousand blank, arranged in an orderly sequence. Number 7, regulates activities of cell according to arrangement of genes. Answers. Number 1 is chromosomes. Number 2 is cell. Number 3 is spermatozoan. Number 4 is nucleus. Number 5 is cell membrane. Number 6 is genes. Number 7 is deoxyribonucleic acid, or you could have put DNA for short. True or false? Number 1. Cells are found in animals but not in plants. Number 2, all tissues and organs in the human body are composed of cells. Number 3, DNA directs cell division and protein synthesis. Number 4, when a sperm and egg unite and form an embryo, they have 46 pairs of chromosomes. Number 5, the older a woman is when she has a baby, the higher her risk is for having a baby with a chromosomal abnormality. Answers. Number 1 was false. Number 2 is true. Number 3 is true. Number 4 is false. This was a trick question. The embryo has 46 individual chromosomes, but there are 23 pairs of chromosomes. Number 5 was true. Questions. Number 1. Cells are made up of a jelly-like substance that is composed of A, water and protein, B, sugar and acids, C, fats and minerals, D, all of the above. Number 2, how many pairs of chromosomes does a human body cell contain? Number 3, which 2 human body cells contain 23 unpaired chromosomes? Number 4, a blank is a photograph of a person's chromosomes. Number 5, why do obstetricians recommend an amniocentesis for a pregnant woman? Number 6, what is another name for Down syndrome? Answers. Number 1 is D. Number 2 is 23. Number 3 is sperm and eggs. Number 4 is karyotype. Number 5, so they can check for chromosomal abnormalities. Number 6, trisomy 21 syndrome. Questions. Number 1, what does the 23rd pair of chromosomes indicate? Number 2, a karyotype shows that the gender of the baby is XX. Is the baby a boy or a girl? Number 3, a karyotype shows that the gender of the baby is XY. Is the baby a boy or a girl? Number 4, and blank is a procedure where the sac around a fetus is punctured so that fluid can be removed. Number 5, true or false? A person with Down syndrome has an extra of chromosome 23. Answers. Number 1 is gender. Number 2 is girl. Number 3 is boy. Number 4 is amniocentesis. Number 5 is false. Questions. Number 1, true or false? A person with Down syndrome has 47 chromosomes. Number 2, true or false? Down syndrome has some distinct physical characteristics. Number 3, true or false? Down syndrome causes mental and heart defects. Number 4, the cytoplasm, A, is everything that is outside the nucleus but within the cell membrane. B, does the work of the cell, for example, makes a muscle contract. C, contains specialized parts that supply the chemical needs of the cell. D, surrounds the cell and protects it, determining what can enter and leave it. E, all of the above. F, all but D. G, A, and B. Answers. Number 1 is true. Number 2 is true. Number 3 is true. Number 4 is F. Give the meaning of the parts. Number 1, cyto. Number 2, plasm. Answers. Number 1 was cell. Number 2 is formation. Finished. Quiz time. The answers will follow the questions slide. Number 1. What provides the primary source of energy for a cell? A, ribosomes. B, mitochondria. C, endoplasmic reticulum. D, amino acids. Number 2, a chemical process where complex nutrients are broken down into simpler substances is known as blank. Number 3, blank is a network of cellular tunnels within the cytoplasm of a cell. Answers. Number 1 is B. Number 2 is catabolism. 3 is endoplasmic reticulum. Number 1. Attached to the endoplasmic reticulum, blank are responsible for building long chains of proteins that are essential for cell growth. A. Ribosomes, B. Mitochondria, C. Viscera, D. Fat cells. Number 2, blank is a process of building larger proteins from amino acids. Number 3, mitochondria are associated with the process of A. Catabolism, B. Anabolism, C. Metabolism. Number 4, ribosomes are associated with the process of A. Catabolism, B. Anabolism, C. Metabolism. Number 1 was A, number 2 is anabolism, number 3 is A, number 4 is B. Number 1, smaller proteins called blank blank are used to make larger proteins. Number 2, true or false? Hormones and enzymes are created by ribosomes. Number 3, blank is the total of all chemical processes that occur in a cell. Number 4, true or false? If a person has a slow metabolism, sugar and fat are burned very slowly and result in fat collecting in cells. Number 5, true or false? Cells are different and don't have any structures in common. Number 6, cells become specialized in the blank stage to perform specific functions in the body. Number 1 was amino acids, number 2 is true, number 3 is metabolism, number 4 is true, number 5 is false, number 6 is embryonic. Number 1, true or false? Cells are different in appearance and characteristics. Number 2, blank cells are long and slender and contain fibers that aid in contracting and relaxing. Number 3, blank cells line tissues and skin cells. Some are flat and square to provide protection. Number 4, blank cells are long and have several fibrous extensions that carry impulses. Number 5, blank cells contain large empty spaces for storing fat. Number 6, blank are a group of similar cells that work together to do a particular job. Number 1 was true, number 2 is muscle, number 3 is epithelial, number 4 is nerve, number 5 is fat, number 6 is tissues. Identify each type of cell. Number 1 is fat cell, number 2 is epithelial cell, number 3 is muscle cell, Number 4 is nerve cell. Number 1, a blank is a scientist that studies tissues. Number 2, true or false, similar tissues are always found in the same area of the body. Number 3, name the 4 types of tissues. Number 4, what is the combining form that means tissue? Number 1 is histologous, number 2 is false, number 3, epithelial, connective, muscle, nerve, number 4, histo. Number 1, true or false, epithelial tissue is found all over the body. Number 2, epithelial tissue lines A, internal organs, B, outer surface of skin, C, endocrine glands, D, exocrine glands, E, all of the above, F, A, and B. Number 3, the word epithelial originally referred to the flesh of what body part? Number 4, the combining forms thelo and theleo both mean blank. Number 5, muscle that is under conscious control is known as blank muscle. Number 1 is true, number 2 is E, number 3 is nipple, number 4 is nipple, number 5 is voluntary. Number 1, true or false, arms and legs have involuntary muscles. Number 2, internal organs usually have muscles that are not under a conscious control, which are known as blank muscles. Number 3, what type of muscle is only found in the heart? Number 4, true or false, cardiac muscle contractions can be detected in a 6-week-old fetus. Number 5, a connective tissue that is fat is known as blank. Number 6, a connective tissue that is flexible and fibrous that is attached to bone is known as blank. Number 1 is false, number 2 is involuntary, number 3 is cardiac, number 4 true, number 5 adipose, number 6 cartilage. Number 1, name the 4 connective tissues. Number 2, what type of tissue conducts impulses all over the body? Number 3, true or false, internal organs are composed of many types of tissues. Number 4, The fancy medical term for a singular organ is blank. Number 5, the fancy medical term for internal organs, plural, is blank. Number 6, name the 6 internal organs that make up the abdominal viscera. Number 1 is adipose, cartilage, bone, blood. Number 2 is nerve. Number 3 is true. Number 4 is viscous. Number 5 is viscera. Number 6, liver, stomach, intestines, spleen, gallbladder, pancreas. Number 1, true or false? Internal organs are organized into bodily systems based on what their function is. Number 2, what system is responsible for digesting food and absorbing it into the bloodstream? Number 3, what is the fancy name for the throat? Number 4, name the 9 internal organs that are part of the digestive system. Number 1 is true. Number 2 is digestive system. Number 3 is pharynx. Number 4 is mouth, throat, esophagus, stomach, liver, gallbladder, small intestine, large intestine, pancreas. Finished. Medical terminology. Lesson 10. The digestive system includes the mouth, pharynx, esophagus, stomach, intestines, small and large, liver, gallbladder, and pancreas. Ureters, tubes that connect from the kidneys to the urinary bladder. Urethra, a tube that leads from the bladder to the outside of the body. The urinary system, also called the excretory system, consists of the kidneys, ureters, bladder, and urethra. The larynx is the voice box. Trachea is the windpipe. The respiratory system includes the nose, pharynx, larynx, trachea, bronchial tubes, and lungs. The female reproductive system includes the ovaries, fallopian tubes, uterus, the womb, vagina, and mammary glands. The male reproductive system includes the testes and related tubes, urethra, penis, and the prostate gland. The endocrine system includes the thyroid gland, the pituitary gland, sex glands, ovaries and testes, adrenal glands, the islets of Langerhans, part of the pancreas, and parathyroid glands. The nervous system includes the brain, spinal cord, nerves, and bundles of nerves. The circulatory system includes the heart, arteries, veins, capillaries, lymphatic vessels, lymphatic nodes, spleen, and the thymus gland. The arteries, veins, and capillaries are collectively known as the blood vessels. The musculoskeletal system includes the muscles, bones, and joints. The sensory system includes the skin and sense organs. The sensory system includes the skin, hair, nails, sweat glands, sebaceous oil glands, eye, ear, nose, and tongue. Quiz time. The answers will follow the question slide. Pick out which terms belong to the digestive system. Answers are in bold italic red, and they are the mouth, esophagus, stomach, intestines, pancreas, liver, pharynx, and gallbladder. Separate which terms belong to the urinary system and which belong to the reproductive system. Divide the terms for the reproductive system into the male and female systems. The urinary system has kidneys, ureters, urinary bladder, and urethra. Female reproductive system, ovaries, fallopian tubes, uterus, vagina, and mammary glands. Male reproductive system has testes, associated tubes of the testes, urethra, penis, and prostate gland. Number 1, blank are tubes that connect from kidneys to the urinary bladder. Number 2, the blank is also known as the voice box. Number 3, the windpipe is known as the blank. Number 4, the blank is a tube that leads from the bladder to the outside of the body. Number 1 is ureters, number 2 is larynx, number 3 is trachea, number 4 is urethra. Separate the terms to show which belong to the circulatory system and to the respiratory system. Some terms may not belong to either. The circulatory system includes the heart, blood vessels, lymphatic vessels and nodes, spleen, and thymus gland. The respiratory system includes the nose, pharynx, larynx, trachea, bronchial tubes, and lungs. Which terms do not belong to the endocrine system? Answers are in red: the thymus gland, sweat glands, prostate gland, sebaceous oil glands, mammary glands do not belong to the endocrine system. Just because they end in glands does not mean it's part of that system. Number 1. What is another name for the urinary system? Number 2. What is another name for the womb? Number 3. The blank and blank are part of the sex glands. Number 4. What organ are the islets of Langerhans part of? Number 5. The blank, blank, and blank are collectively known as the blood vessels. Number 6. The urethra is part of what two body systems? Number 7. The nose is part of what two body systems? Number 8. Ovaries and testes are part of what two body systems? Number 1, the excretory system. Number 2, uterus. Number 3, ovaries, testes. Number 4, pancreas. Number 5, arteries, veins, capillaries. Number 6, male reproductive system, urinary system. Number 7, respiratory system, sensory system. Number 8, reproductive system, endocrine system. Number 1, what 4 things make up the nervous system? Number 2, what 3 things make up the musculoskeletal system? Number 1, brain, spinal cord, nerves, bundles of nerves. Number 2, muscles, bones, joints. Which terms do not belong to the sensory system? The answers are in red. The penis, mammary glands, mouth, muscles, and nerves do not belong to the sensory system. Quiz time. The answers will follow the question slide. Match the term to the definition. Number 1, voice box. Number 2, flexible connective tissue attached to bones at joints. Number 3, throat. Number 4, a group of fat cells. Number 5, skin cells that cover the outside of the body and line the surfaces of internal organs. Number 6, a specialist that studies tissues. Number 1, larynx. Number 2, cartilage. Number 3, pharynx. Number 4, adipose tissue. Number 5, epithelial tissue. Number 6, histologist. Match the term to the definition. Number 1, windpipe. Number 2, endocrine gland that surrounds the trachea and the neck. Number 3, endocrine gland located at the base of the brain. Number 4, a tube that leads from the kidney to the urinary bladder. Number 5, the womb. Number 6, a tube that leads from the urinary bladder to the outside of the body. Number 1, trachea. Number 2, thyroid gland. Number 3, pituitary gland. Number 4, ureter. Number 5, uterus. Number 6, urethra. Match the term to the definition. Number 1, this body cavity contains the lungs, aorta, esophagus, trachea, bronchial tubes, and thymus gland. Number 2, medical term for internal organs. Number 3, the body cavities located in front portion of the body. Number 4, the body cavity that holds the brain and pituitary gland. Number 5, a space that holds the internal organs. Number 6, the body cavities located in the back portion of the body. Number 1, thoracic cavity. Number 2, viscera. Number 3, ventral cavities. Number 4, cranial cavity. Number 5, body cavity. Number 6, dorsal cavities. Match the term to the definition. Number 1, the space between the pleural sacs that surround each lung. Number 2, a cavity that contains the heart, aorta, esophagus, lungs, trachea, thymus gland, bronchial tubes, and lymph nodes. Number 3, muscular wall that divides the thoracic and abdominal cavities. Number 4, cavity contains the stomach, small intestines, large intestines, spleen, pancreas, liver, and gallbladder. Number 5, double-folded membrane that surrounds lungs and protects them. Number 6, the large artery. Number 1, pleural cavity. Number 2, mediastinum. Number 3, diaphragm. Number 4, abdominal cavity. Number 5, pleura. Number 6, aorta. Number 1, what body cavity contains the small and large intestines, the rectum, urinary bladder, and ureters? Number 2, true or false, in females, number 1 also contains the vagina and uterus. Number 3, what body cavity contains the nerves of the spinal cord? Number 4, true or false, the thoracic and abdominal cavities are considered separate cavities. Number 5, the external ear and nose are composed of blank. Number 1, the pelvic cavity. Number 2, true. Number 3, the spinal cavity. Number 4, false. Number 5, cartilage. Number 1, the larynx is located at the upper part of the blank. Number 2, a common passageway for eating and breathing is the blank. Number 3, the blank is a tube that leads from the throat to the bronchial tubes. Number 4, how many ureters does the human body have? Number 5, the blank houses the embryo fetus as it develops. Number 6, if viscera is used to refer to internal organs, what term would you use to refer to only one internal organ? Number 1, trachea. Number 2, pharynx. Number 3, trachea. Number 4, 2. Number 5, uterus. Number 6, viscus. Number 1, name the 5 body cavities. Number 2, what is another name of the ventral cavities? Number 3, what body cavities make up the ventral cavities? Number 4, what is another name for the dorsal cavities? Number 5, what body cavities make up the dorsal cavities? Number 6, the thoracic cavity is divided into 2 cavities, the blank and the blank. Number 7. What are the two names that refer to a condition where the pleura becomes inflamed and fluid fills the pleural cavity? Number 1, thoracic, cranial, spinal, pelvic, abdominal. Number 2, anterior cavities. Number 3, thoracic, pelvic, and abdominal cavities. Number 4, posterior cavities. Number 5, spinal and cranial cavities. Number 6, pleural cavity, mediastinum. Number 7, pleuritis, pleurisy. Number 1, the blank is located in the center between but outside of the lungs. Number 2, the blank is a double-folded membrane that surrounds the abdominal cavity. Number 3, the blank are found behind the abdominal cavity and on each side of the backbone. This area is also known as the blank area. Number 4, what two body cavities are the small and large intestines in? Number 5, the thoracic and abdominal cavities, when referred to as a whole, are known as the blank cavity. Number 1, mediastinum. Number 2, peritoneum. Number 3, kidneys, retroperitoneal. Number 4, pelvic and abdominal cavities. Number 5, abdominopelvic. Medical terminology, Lesson 12. The omentum is located in front of the abdomen and is part of the peritoneum. It is made up of fat and hangs over the intestines. Its purpose is to keep them warm. The abdominal cavity is also known as the abdomen. The spinal cavity is also known as the spinal canal. It is the space within the spinal column that contains the spinal cord. The diaphragm separates the abdominal and thoracic cavities. This muscle moves up and down, which helps in breathing. Membranes cover and protect organs. The peritoneum surrounds the abdominal viscera, liver, small intestines, large intestines, and stomach. The pleura covers the lungs. The periosteum protects the bones. The meninges surround the brain and spinal cord. Homophones. Plural and plural are homophones, meaning they sound alike though they are spelled differently and have two different meanings. Plural, P-L-E-U-R-A-L, membranes surrounding the lungs. Plural, P-L-U-R-A-L, means more than one. The abdominal pelvic area is divided into 9 regions. The abdominal pelvic diagram is divided according to a patient's right and left. If you are facing the patient, their right lumbar region will appear on your left, but it is their right. However, you will call it the right lumbar region. Be sure not to confuse this. Surgeries being performed on the wrong side of the body have probably resulted from this mistake. Right hypochondriac region. The right hypochondriac region is the upper right region below the cartilage of the ribs that spread over the abdomen. The term hypochondriac, when you break it down, literally means pertaining to below the cartilage. The prefix hypo means below. The combining form chondro means cartilage. The suffix iac means pertaining to. The left hypochondriac region is the upper left region under the rib cartilage. The epigastric region is the area above the stomach. The right lumbar region is the middle area on the right near the waist. The left lumbar region is the middle area on the left near the waist. The umbilical region is the navel area, also called the umbilicus. The right iliac region is also known as the right inguinal region. It is the lower region on the right that is near the groin. The groin is the area where the legs join the torso of the body. The combining form inguinal means groin. The left iliac region is also known as the left inguinal region. It is the lower region on the left that is near the groin. The regions are called iliac because they are near the ilium, which is the top portion of the hip bone. The hypogastric region is the middle section below the umbilical region. Hypogastric literally means pertaining to below the stomach. The prefix hypo means below. The combining form gastro means stomach. The suffix ic means pertaining to. Quadrants. The abdominal pelvic area is also divided into 4 quadrants. Like the regions, quadrants are divided according to a patient's right and left, not your right and left when facing them. The right upper quadrant contains the right lobe of the liver, the gallbladder, part of the pancreas, and parts of the small and large intestines. The abbreviation for this quadrant is RUQ. The left upper quadrant contains the left lobe of the liver, stomach, spleen, parts of the pancreas, and parts of the small and large intestines. The abbreviation for this quadrant is LUQ. The right lower quadrant contains part of the small and large intestines, appendix, and right ureter. In females, it also contains the right ovary and right fallopian tube. The abbreviation for this quadrant is RLQ. The left lower quadrant contains parts of the small and large intestines and the left ureter. In females, it also contains the left ovary and left fallopian tube. The abbreviation for this quadrant is LLQ. Quiz time. The answers will follow the questions slide. Questions. Number 1. What is the plural of vertebra? Number 2. How many divisions are there in the spine? Number 3. Name the divisions of the spine. Number 4. What is another name for the tailbone? Number 5. True or false? The tailbone is made up of 5 fused vertebrae. Answers. Number 1 is vertebrae. Number 2 is 5. Number 3, cervical, thoracic, lumbar, sacral, and coccygeal. Number 4, coccyx. Number 5, false. It is made up of 4 fused vertebrae. Match the term to the definition. The terms are vertebra, cervical vertebrae, thoracic vertebrae, the lumbar vertebrae, the sacral vertebrae, and sacrum. Number 1, vertebrae that are joined to a rib and make up the chest region. Number 2, 5 bones that are fused together. There can be 2 answers for this. Number 3, a bone that is found in the spine. Number 4, 5 vertebrae found between the ribs and hip bone. Number 5, 7 vertebrae found in the neck region. Answers. Number 1 is the thoracic vertebrae. Number 2, sacrum, the sacral vertebrae. Number 3, vertebra. Number 4, lumbar vertebrae. Number 5, the cervical vertebrae. Match the letters to the correct region. The regions are the cervical vertebrae. Number 2 is the thoracic vertebrae. Number 3, the lumbar vertebrae. And number 4 is the sacral vertebrae. A. The abbreviation for the vertebrae in this region is S. B. This region has 7 vertebrae. C. This region has 12 vertebrae. D. The abbreviation for the vertebrae in this region is C. E. The abbreviation for the vertebrae in this region is L. F. The abbreviation for the vertebrae in this region is T. G. This region has 5 fused vertebrae. H. This region has 5 vertebrae. Answers. Number 1 is B and D. Number 2, C and F. Number 3, E and H. Number 4, A and G. Label the divisions of the spine. Answers. A is cervical, B is thoracic, C is lumbar, D is sacrum, E is coccyx. Fill in the blanks. A small pad that is composed of cartilage and water that is found between vertebrae and acts like a shock absorber is known as a blank, also spelled blank. If it moves out of place and puts pressure on a nerve, causing pain in any part of the body affected by the nerve, the condition is known as a blank or blank. Answers. A small pad that is composed of cartilage and water that is found between vertebrae and acts like a shock absorber is known as a disc, also spelled D-I-S-C. If it moves out of place and puts pressure on a nerve, causing pain in any part of the body affected by the nerve, the condition is known as a herniated disc or slipped disc. Questions. Number 1, true or false? The spinal column refers to the nerves that are surrounded by and protected by the vertebrae. If false, what is the spinal column? Number 2, the spinal column is what type of tissue? Number 3, the blank blank is nervous tissue surrounded by the spinal column. Number 4, the spaces between the vertebrae where discs are located are known as blank blank. Number 5, what is the space labeled if it is between the 12th thoracic vertebra and the first lumbar vertebra? Number 6, what is the space labeled if it is between the second cervical vertebra and the third cervical vertebra? Answers. Number 1, false. The spinal column refers to the vertebrae. Number 2, bone tissue. Number 3, spinal cord. Number 4, intervertebral spaces. Number 5, T12 to L1. Number 6, C2 to 3. Match the term to the definition. The terms are anterior, ventral, posterior, dorsal, deep, superficial, proximal, and distal. Number 1, synonym of posterior. Number 2, near the beginning of a structure or point of attachment to the trunk. Number 3, away from the surface of the body. Number 4, far from the beginning of a structure or from the point of attachment to the trunk. Number 5, synonym of anterior. Number 6, back side of the body. This can have 2 answers. Number 7, front of the body. This also can have 2 answers. Number 8, on the surface. Answers. Number 1 is dorsal, number 2 is proximal, number 3 is deep, number 4 is distal, number 5 is ventral, number 6 posterior, dorsal, number 7 anterior, ventral, number 8 superficial. Match the term to the definition. The terms are inferior, caudal, superior, cephalic, medial, lateral, supine, and prone. Number 1, above another structure. There can be 2 answers for this. Number 2, below another structure. Again, 2 answers. Number 3, pertaining to the middle or near to the medial plane of the body. Number 4, lying on the back. Number 5, lying on the belly. Number 6, pertaining to the head. Number 7, pertaining to the side. Number 8, below another structure, but more specific to the lower portion of the body away from the head, literally meaning pertaining to the tail. Answers. Number 1 is superior, cephalic. Number 2, inferior, caudal. Number 3, medial. Number 4, supine. Number 5, prone. Number 6, cephalic. Number 7, lateral. Number 8, caudal. Quiz time. The answers will follow the questions slide. Remember, folks, you can always hit the pause button on the video. I may be moving through this a lot faster than you have time to answer because it may be a long quiz. And I try to keep the videos no more than 13 minutes tops. Questions. Number 1, how many planes is the human body divided into? Number 2, what type of view is an X-ray from? Number 3, what type of plane is shown in the picture on the right? There can be two answers for this. Answers: 3, 2, postero-anterior view. Number 3, the sagittal plane or the lateral plane. Match the terms to the definitions. The terms are frontal plane, coronal plane, sagittal plane, lateral plane, transverse plane, axial plane, CT scan. Number 1, divides the body into upper and lower portions. There can be two answers for this. Number 2, divides the front and back parts of the body. There can also be two answers for this. Number 3, divides the body into right and left halves. Two answers too, again. Number 4, computed tomography scan. Number 5, another name for frontal plane. Number 6, another name for the sagittal plane. Number 7, another name for the transverse plane. Answers: number 1 is transverse plane or axial plane. Number 2, frontal plane or coronal plane. Number 3, sagittal plane or lateral plane. Number 4, CT scan. Number 5, coronal plane. Number 6, lateral plane. Number 7, axial plane. Questions: number 1 and number 2. Name the planes that are being shown. Number 1 is the frontal or coronal plane. Number 2 is transverse or axial plane. Questions: number 1, a blank is a concept where the human body is divided into imaginary flat surfaces. Number 2, which type of plane is a lateral X-ray in? Number 3, what type of plane is a CT scan taken in? Number 4, what two combining forms mean nipple? Number 5, blank blank is where the body is standing upright facing you, the feet are flat to the ground and pointed forward, the arms are at the sides with the palms facing forward. Number 6, true or false? The combining form cervico can mean neck of the body as well as neck of the uterus. Answers: number 1, plane. Number 2, sagittal or lateral plane. Number 3, transverse or axial plane. Number 4, thelo or thelio. Number 5, anatomic position. Number 6 is true. Write down what each combining form means. Number 1, abdominal. Number 2, chondro. Number 3, dorso. Number 4, histo. Number 5, ilio. Number 6, cario. Number 7, latero. Number 8, medio. Number 9, nucleo. Number 10, sacro. Answers. Number 1 is abdomen. Number 2, cartilage. Number 3, back portion of the body. Number 4, tissue. Number 5, ileum. Number 6, nucleus. Number 7, side. Number 8, middle. Number 9, nucleus. Number 10, sacrum. Write the combining form for the definition. Number 1, to cast or throw. Number 2, far or distant. Number 3, pelvis or hip region. Number 4, back or behind. Number 5, spine or backbone. Number 6, trachea or windpipe. Number 7, navel or umbilicus. Number 8, vertebrae or backbones. Number 9, belly side of the body. Number 10, fat. 11, color. Number 12, front. Number 13, groin. Number 14, lower back. Number 15, chest. Number 16, internal organs. Answers. Number 1 is bolo. Number 2, disto. Number 3, pelvi. Number 4, postero. Number 5, spino. Number 6, tracheo. Number 7, umbilical. Number 8, vertebro. Number 9, ventro. Number 10, adipo. Number 11, chromo. Number 12, antero. Number 13, inguino. Number 14, lumbo. Number 15, the thoraco. Number 16, viscero. Write down the meaning of the combining forms and prefixes. Number 1, causago. Number 2, cranial. Number 3, cyto. Number 4, ana. Number 5, cata. Number 6, epi. Number 7, hypo. Number 8, inter. Number 9, meta. Answers. Number 1 is coccyx. Number 2 is skull. Number 3 is cell. Number 4 is up. Number 5 is down. Number 6 is above. Number 7 is below. Number 8 is between. Number 9 is change. Number 1, the suffixes iac, eel, and ear all mean blank blank. Number 2, which suffix means process or condition? Number 3, which suffix means pertaining to or full of? Number 4, the suffix plasm means blank. Number 5, the suffix somes means blank. Number 6, which suffix means picture or classification? Number 1 means is pertaining to. Number 2 is ism. Number 3 is os. Number 4 is formation. Number 5 is bodies. Number 6 is type.